Hi, I'm Dr. Mangat, the Medical Director of Primary Care Services here at Niagara Falls Memorial Medical Center. And I'm here today to talk to you about diabetes, its risk factors, prevention, and management of this burdensome disease today. What is diabetes? Diabetes is a metabolic disorder which is characterized by chronically elevated blood sugars in the body because of a disturbance in the carbohydrate, the protein, and the fat metabolism in the body, which results from a defect in insulin secretion, insulin action, or both. Most of the diabetics have underlying borderline diabetes for years and years, which sometimes goes undiagnosed. What is borderline diabetes or prediabetes? Borderline diabetes is when your sugar levels in the body are high but not high enough to be labeled as diabetes. If you have borderline diabetes, you might end up developing full-blown diabetes in 7 to 10 years if you do not take control actions now. Borderline diabetes also increases your risk of developing heart problems. Some of the long-term complications of diabetes include diabetic retinopathy, which increases your risk of blindness, diabetic nephropathy, which can cause kidney problems and end up with renal failure, diabetic neuropathy, which is painful sensation in the hands and the feet, which is sometimes very difficult to control. Some of the more serious complications include coronary artery disease, peripheral arterial disease, and cerebrovascular disease or strokes. What are some of the most common symptoms that we see patients presenting with? In the textbook, it says the 3 Ps, which we do see all the time: polyuria or increased urination, polydipsia or increased thirst, polyphagia or an increase in your appetite. Sometimes patients notice that there is an unexplained weight loss, there is visual disturbances, there is extreme amounts of fatigue, which they cannot understand what and why that is going on. Diabetes has a huge economic burden. It accounts for around 6 to 12% of our annual healthcare expenditure. International Diabetes Federation is projecting that by the year 2025, almost 333 million people are projected to be suffering from diabetes, 90% of which will have type 2 diabetes. I have been taking care of patients with diabetes for almost 15 years, and myself, along with my great team of other doctors and providers here at Golisano Primary Care Center, we will help manage and, even better, prevent this disease called diabetes. Call us at 278-4151 for an appointment today.